Hives, the rash that will make you want to take your skin off. Ava often gets a red, itchy rash like a nettle sting. Sometimes it's accompanied by swelling of the eyes and lips. The symptoms move around, they come and go, and the itching is unbearable. Ava's doctors diagnose chronic spontaneous urticaria, CSU, also known as hives. Hives is a skin disease characterized by the appearance of a red, itchy, bumpy rash, swelling, or both. Depending on how long it lasts, there are two types of urticaria, acute and chronic. The acute form lasts less than 6 weeks. The chronic form lasts 6 weeks or more. The chronic form can be further divided into inducible and spontaneous. In the case of chronic inducible urticaria, we are aware of triggers that can cause histamine release from mast cells. These triggers include heat, cold, pressure, physical activity, some medicines, and foods. In 2 out of 3 patients, the trigger is never found. Ava is one of these patients. Despite the endless examinations, suffering, insomnia, and strict antihistaminic diets of carrots, rice, and water, the doctors never work out what is causing the rash and swelling. To understand the activity of hives, questionnaire UAS7 is used to evaluate the number of bumps and the intensity of itching. To give a score of hives activity, this questionnaire is completed by the patient themselves over 1 week. For the better diagnosis of urticaria, patients are encouraged to record, in addition to what they have been eating and drinking, what medicines they have taken, and what physical activities they have done. Because the symptoms change fast, you should also take photos so that the doctor can diagnose you more quickly and begin effective treatment. Non-sedating antihistamines are used to treat hives with standard or quadruple doses. If the symptoms persist after 4 to 6 weeks, the guidelines recommend adding biological treatment given by injection under the skin every 4 weeks. Systemic corticosteroids may be given for short periods at the onset of hives, but not for longer than 10 days. That Ava suffers from hives is not quite a coincidence. It's estimated that urticaria affects up to 1 in 4 people, mostly aged from 20 to 40. Usually it will disappear within 1 to 5 years, but it may last for decades. Nowadays, effective therapy is available for the treatment of chronic spontaneous urticaria, which will enable you to live a happy, hives-free life again shortly. If you think you suffer from hives like Ava, remember that careful preparation for your doctor's appointment is the secret of success. Record all the symptoms in your diary, take photos, and find a specialist in your area.